Welcome everyone. This is the clinical incubator, the Incubating Clinical Education Research. It's our Getting Started series. So this is for clinical educators who are just either starting out or wanting some reminders of some of the basics, or those who are just vaguely interested that they might want to get involved in education research and want a bit of an idea. So you're really, really welcome. Just to mention that this is the Getting Started series. The incubator also runs a couple of other levels. There's a Mastering the Basics level and even some webinars for supervisors as well. So do have a look on the website, and the link to the website you probably know because you had to sign up for the talk, but we'll pop that in the chat box anyway. So this session is about predominantly about PPI, but we're going to mention just passing ethics and funding and some of the other practicalities. But predominantly we're talking and discussing about the using PPI in research. My name's Hugh Alberti. I am Professor of General Practice Education at Newcastle University. And Katie Webb, I'm very pleased, is joining us to discuss, I think Professor Katie Webb now is to come to discuss PPI as an expert in the area. We would encourage you, if you don't mind, to use the chat box just to introduce yourself. I had a question. So just pop in your name, where you work, maybe your background, because then you might find, oh look, there's someone in the next door office who's also here, or you might find some connections or collaborators that you want to work with. So that's great. And I'm mostly just nosy, interested to know who's there. Just some practicalities. Well, there'll be a bit of a talk part, but with some participation just through the chat box that we'll illustrate as we go along. There will be a couple of times then we'll stop sharing the slides and just opportunity to ask questions, but do put questions in the chat box as well as we go along, and we'll make sure they're covered. So feel free to, please put yourself on mute, and apologies if there's any background noise whilst I'm talking, but I'll mute myself as well. But then when we're doing the Q&A, it'd be great if you don't mind putting your videos on, just so we can see who's here and who's asking questions. Just couple of last notes just about practicalities. The recording will be available on the website from next week, and the slides will be as well. And as I said, this is a monthly webinar that we have. So you've missed some fantastic webinars on qualitative research, analysis, etc., but they're all available on the website. And then next month there will be how to get published, and then careers the month after. So do have a look at the website for other webinars that we are running. If you do need a certificate for attendance, then please just email us and we'll put up the email address at the end. And likewise, any feedback, such as the presenters should decide before 1 minute beforehand what they're going to say. Any feedback like that, feel free to submit via the email as well. This is a basic outline of what we want to cover. Sorry, already gone. So mostly, as I said, covering PPI and then moving on to a bit of touching on ethics and funding. And as I said, if you just pop your name in the chat box where you work, that's really interesting and helpful for us. And without further ado, I will now pass over to Professor Webb to lead us in a discussion about PPI. Thanks, Katie.
Thanks, Hugh. Thanks, and apologies. I'm not your Chris Whitty, am I, really, when it comes to being able to forward the slides for you effectively. So sorry about that, everyone. Just to say and I put it in the chat there, to Hugh's point about all of the various activities that the incubator are running, of which there are numerous. At the end of the presentation today, there are a few QR codes for you to scan, actually, that might help take you to those. So public patient involvement and engagement, what is it? So before we get cracking on with that, it would be really great if you could please enter into the chat your thoughts around understanding about what this means to you, actually. What is participant patient involvement, and now increasingly the E on the end, the engagement activity? Anybody got any thoughts? Collaboration with people with lived experience, yeah. The included population, okay, so those that you're seeking to work with, initiatives designed for way of engagement to give your project more relevance, absolutely, yeah. And increasingly, this is becoming incredibly important within research proposals, grant submissions, and when we're writing for outputs and manuscripts, isn't it? Used throughout the research process, absolutely. So I'm incredibly passionate about public power. Excuse me, my words are getting it wrong. Public patient involvement and engagement. Extremely passionate about that. And I see it very much that we are co-producing lots of research. We need to be mindful about who it is that we're doing these things for and for why. So it increases quality, relevance, trust, experiential learning, and as you say, lived experiences. And that's super important because it can be very easily done that within research groups, academic groups, and in the NHS particularly, when folks are doing and designing initiatives for people, that it is seemingly about the do, and sometimes some of those creations are too far from the patient and their lived experiences. So the involvement then is where members of the public are actively involved in the design and conduct of research. For example, as co-applicants, as a member of the advisory group, as part of the research team, in developing materials, interviewing research participants in some cases, really part of the team, analysing the data and or disseminating results. Patient and public involvement in research is where research is being carried out with and by members of the public, not just to or for them. And I think going to that point about the NHS and thinking about efficiency and efficacy of what we do with regards to understanding about people's experiences within service, what things matter, the efficiency and how patient pathways are designed. It's really, really important that actually we hear the lived experiences, the variability of experiences of those who and from whom we want to provide those services for. So why incorporate patient public involvement and engagement? Why might you want to incorporate PPI in a project? What might it give you? So as I say, more actively over the last few years, there's an explicit requirement in many bids. The journal articles are asking if there's been patient involvement in some of these works. It's being designed in to make sure that people are cognizantly thinking about incorporation of people. I'm planning to use PPI as feedback to see if my research ideas have legs. Absolutely. So this is even at a pre-design phase then that somebody's talking about that. You're talking about the feasibility early on. That's really, really important. Hugh and myself do an awful lot of work within longitudinal integrated clerkships. A main and consistent pillar around that is around community. What do the community need? What's important to them? Not what we feel is important, but actually what is important to them. So going to your point here about where along this line of planning you're using PPI, you're using it at the very outset, more like a hackathon that they use sometimes, where they pose a kind of idea problem and then they're getting people to work around it. I think that's really, really important. Again, because it raises the issues of where are their shadows? What's being missed? Where are the gaps? And so why incorporate that? It increases the quality of research, includes important perspectives and experiences. As I say, the research that we do, why we do it is because people are important to us. The best and highest quality of care in all our services is important to us. So we're doing it from a place of good to try and find out what works for whom and in what circumstances. Sometimes inadvertently, when these projects are put together and from people who do not have the lived experiences of those that they seek to help, if I can say that word, we miss important points because we do not have those experiences, and we are not necessarily on the ground with that. So it's really important that we don't miss perspectives and issues. Again, thinking about unconscious bias, I think that's a really, really important point, actually, that we are hearing what people in certain communities, certain groups experience on a day-to-day in their own social world and realities. So it increases relevance and values. In terms of study processes, with regard to all of that, it increases efficacy. So when we think about recruitment, to whom, retention, information sheets, so communication sources, interpretation of results. When we're analysing data, if we have the participation and involvement from those communities, and we are using those folks as co-creators, that they can look at the data and interpretation of results too. It provides that other level of complexity and introspection of which we seek. So we're not looking at it on a kind of reductionist level in what makes sense to us and our own experience through those lenses, but actually thinking in a more nuanced sense about what it is that people are saying and what it means to those people. Because the British language, the English language, is full of multiple meanings, and so we can misinterpret sometimes what folks are saying. Thinking about impacts. So it's really valuable to have this involvement, engagement, and co-production in terms of dissemination of the results and sharing of those results with the public. Actually, how do those results come across, for instance? Do they make sense to someone? Are they sounding too scientific, too jargon-based, something that is designed in such a way that it's not accessible to the people in the communities with whom you're wanting to share those data with? So again, it's really important that involvement can actually make positive gains and positive influences across all steps within the research, study, evaluation process, whatever it is. And I spoke about efficiency, and if we think about it in terms of a kind of iceberg model, and I know that this kind of image gets used a lot within healthcare, actually. It's really important that we think about where our time and attention goes. And if we have early involvement and co-production early, we seek to avoid some of these kind of wastes and deleterious effects actually to the research process. So if we introduce, and one of the participants on the call mentioned about engagement early on to test out some of those ideas, then earlier on, you're able to focus your attentions, you're able to focus your time. That leads to saving money, thinking about what's wasteful, thinking about excessive field work, for instance. You're able, with involvement, and those from communities may act like a gateway, if you like, so that you're able to up on your recruitment. A lot of times, particularly for hard to reach areas of the community, a lot of the data, if you look at the literature reviews, struggle in terms of the evidence base because of low response rates. very difficult accessibility. However, if you have folks from certain communities that are seen and trusted within those communities, they're able to help in that kind of transition and conduit, if you like, for access, which means that your recruitment, the quality of the study, and all of those other key elements then fall out of that and is more positive. So when we think about the pragmatics and the reasons for involvement in research from the outset, it can help to mitigate against those risks to the research, to the study, and thus the quality of whatever it is that you might be looking at. So there are various examples of PPI that have been used that are on various projects that I've worked with. Translation of improvement skills. That was a project that was centered around community of practice and GP practice-based pharmacists and whether they were able to implement their improvement skills. And so it was really important to have that involvement throughout that process. So we had the advisory board, we had lay persons on the advisory board, so members of the public who are themselves, we're all patients. There were other practice-based pharmacists on the advisory board, as well as the chief pharmaceutical officer, as well as academics, as well as the GP lead for Wales. But it really helped in grounding actually and getting those perspectives around the table, so it's not an echo chamber when you're in these meetings, that it's very firmly on the project and on the people. And that assisted also in the dissemination and the translation of that work, that it was reviewed, it was sent out to stakeholder groups, and then that advice was fed back. So that really helped with the shared decision making. In terms of the HEE's Less Than Full-Time Category 3 initiative, which crossed over through COVID, they all had impact from involvement of patient public, in that very early on they helped with design decisions. So we spoke about that a little earlier. Research instruments, so making sure that the research instruments, that the questions that were being asked were understood on the other side. So the potential participant who was then interacting with those research instruments, whether it be a survey, whether it be the interview topics, that they were readily understandable, that the participant information sheets were understood in a way that it enabled participants to really understand what informed consent for the work was. So it wasn't hidden behind a wall of jargon, you know, in terms of GDPR and the technical terms around data management, for instance, what was going to happen with results post-study, that it's really clear for people what their information is being used for, how it's being used, and also where they are along the line, and if they can review, have early sight of some of the summary documents. So we also had really positive engagement in terms of analytical discussions, again having that other perspective, if you like, on what people talked about. How language is used colloquially is really important from place to place. So again, in terms of understanding thresholds of when people talk about, you know, stress at work, and for instance, one of the wider projects that I did is looking at burnout, the effects of burnout, and there's another one on mental health and social care and disability benefits. It's really important to understand the language used and the perspectives that folks are coming from. For the beliefs around common mental health problems at work, involvement was used again in terms of engagement and recruitment, what mattered, what were the local issues and who were the champions. It really provided that other level of access and insight. For quality improvement skills, again, it's really important that if these interventions and initiatives are going to be relevant to patients, that they have involvement around the design of what that means. And so they had early sight of some of those designs, and that was working within GP practice and trying to implement a readiness model to patient pathways for care and online triage forms. So what we're talking about really, and when we talk about the evidence base, we always talk about, is it trustworthy? Is it rigorous? Is it systematic? Are the results, conclusions, assumptions grounded in data? And therefore we need to make sure that that data is relevant, is of high quality. This is an example of how having patient public involvement in translation of information was important for this study. So here you can see an example of a public document that was feeding back data from this particular project that was looking at cognitive function in delayed post-stroke and aging-related dementia. So they were, for their participants, they had completed this study and they wanted to share the results with more widely with those families and with the British Foundation, and they wanted to disseminate these research more widely. So to their advisory group and their public PPI contributors, they fed this back. And so this is what they were going to do from their perspective as scientists. Upon seeing that, the feedback were that in order to make that accessible, they needed to replace jargon, they needed to omit the numbers. It's what made sense to people in seeing the results of that study. Preparation of a separate glossary of terms to lay people and people who really wanted to know what the difference was and where the results were heading. It was important for them to get to the nub of what those positive results or where the gaps were, recommendations were from that. Inclusion of pictures to make it more accessible, omission of graphs and tables, and inclusion of a quick read section. So if we go back to it, on the face of it, you can see that it's very text heavy. The collaborators, the researchers here have tried to really explain out the results that they've seen. They've tried to be diagrammatic here. They put a couple of charts in with plotting some of those points. They've got a table in there and bar chart, thinking that that is communicating the results and people can take it on. Unfortunately, it's seen as too complicated from the PPI reviewers, and this is what it ended up being like. The article, this infographic, is far more accessible. It has key elements, those results that matter to the people who are reading it. What is it that they need to know and why do they need to know it? A simplified diagram of the brain. It gives them the aims of the study, and it's a lot easier for people to see and read at distance. So it meant that they were able to interact with it a lot easier. So how can you think, already we've got folks who've said that they're thinking about PPI at a really, really early stage in their project development. So how do you feel that you could incorporate PPI into a project? Maybe you're doing it already. Maybe you've got something that's already in train and begun, but maybe you could kind of bring it in even at a later stage. How might you incorporate PPI into a project? Any thoughts? In an advisory group, yeah. Yeah. You could have them in to sound out, as you say, some of those ideas. They could be in an advisory group from the outset. I'm hoping that after my scoping exercise, I have a group which may continue in an observation advice group. Yeah, that would be good as well. Again, you could feedback some areas of the results if you didn't feel that ethically you could share data with those individuals. It might be that you were able to share some kind of high level elements of some results that were coming out to kind of hear early thoughts on where things are going. And the direction of travel in that. It might be that you really want somebody involved in it, in which case they become a kind of interviewer for you, and properly participating in it. Where does the boundary lie between PPI and an actual participant? The PPI involvement is that they are contributing to. When you have a participant, they are providing a response to, if that makes sense, where you would be using their data that you would then analyze and take responses from. The PPI involvement, we talked about whether or not they're they're able to review some of the results that you've got. They're a contributor, if you like, to that. They're not giving you results that you would add into your study. It might be that you want to report on it in a way that how it was beneficial to you, and in terms of, as you would with any other study around strengths and limitations and all of those sorts of things. It may be that you wrote a discussion piece, for instance. It may be that from somebody's involvement in something that you are able to provide a model or a template of inclusion so that others may follow how you've done it more readily, but that would be the distinction. So as you mentioned, you've got advisory board, thinking about research team, and so co-facilitator, co-production in terms of checking the instruments. And thinking back to that iceberg diagram, I think it's really useful to have that in your head all of the time when we think about efficiency. One of the greatest risks to any kind of research project is delay, and focus. And if the beginning, you put the work in the beginning to make sure that the instruments are understandable, and so that the data that is then entered in by participants is the data that you need and the data that you want, which equals high quality data. That helps with maintaining the study and the momentum of that study. If you find that you have problems with research and retention because individuals aren't able to understand what's asked of them, or get confused, or maybe answer data collection tools in a way that is misunderstood to what you were intending, then it can jeopardize the quality of that research. Expert review and feedback, really, really important, and excellent for reviewing that. So who has access? So arranging PPI, some people find it difficult thinking about, well, where do I go? How do I start? So think more locally. What have you got near you? So you've got if you work in a university, you'll have public involvement and engagement groups. If you're in hospitals, you'll have hospitals patient partnerships. they're really useful to contact. You'll also have someone like a joint research office. There'll be research panels, expert patient groups, whichever area of work it is that you're working with, young people and parents, and there are groups for those. So there are other projects that have done for cared for young adults and other patients, so pediatric oncology and those sorts of things. And so there are different groups around that, and charities, of course, peers, and placing adverts in settings. So you might often see that there are adverts in hospital and clinical settings actually inviting inviting folks to participate in PPI. This is one of them. I was walking around the hospital and saw that the other day. So, think creatively about that. But you can go and ask advice. So the R&D office, if you have an R&D office, as I say, in the university for patient for public involvement, and the joint research office. And you've also got the incubator. We're always happy to help and answer any questions that you might be thinking about. And so consider where you might want involvement. So considerations, is it designed in? Thinking about ethics, you need to, when you are designing in patient public involvement within research, you need to be really clear in ethics about where that patient part, oh, there we go, PPI is, and being really clear about the permissions for that and the parameters within which those individuals participate. For instance, if they're going to be doing data analysis and interviewing, you would need to be careful about that there was pre-training and that those individuals are looked after in the research sense. There's a high duty of care thinking about that. That's not just for the individual who is taking part to help you in your study during the course of that study, but also remembering afterwards, they will be changed from taking part in that study. And it may be that you want to think about, helping them. Do they want to take part in other things, for instance, and other areas? And also thinking about the duty of care for their individual when they go back to their community. If you've said about disseminating information to those who have participated in a study, then you need to follow through on those promises to make sure that it's tied up. And also thinking about how things are written, because those individuals that may have helped with that access, gateway access, as I mentioned, will be part of that community. So being sensitive again, as we are when we think about how we write up results and data to those who will be reading it and recognizing themselves in that. So, and also thinking about post-project sustainability. Is it that there will be a continuation of a project? Sometimes we have work packages and phases. So thinking very carefully from the beginning, okay, so you've ticked the box, you've got the participant patient involvement up front. Actually, if there are developments within the project, an intervention gets made, then it gets evaluated and redeveloped. At what point do you have PPI running through the whole project? Thinking longitudinally then around that, again, thinking about the authenticity and that trust. It's really important to build trust. If you lose the trust, word gets round, then it's going to be really difficult to continue with portfolios of work in that area. And if you, as I say, if you're struggling with anything, if you've got any questions, you're interested, don't know where to start, reach out. We'd be more than happy to help you with that. So thinking a little bit about kind of personal activity and a bit of homework for you guys, I suppose, is thinking about how can you incorporate PPI in what you do. Consider a project either hypothetical or something you might in the future be involved in? How could PPI help in this project? Who would be involved? How will you invite them and access these folks? In what way might these individuals be involved? And when might they be involved? As I say, you've got really early involvement in that kind of ideas stage, as somebody was talking about, or it might be that folks are brought in to do different stages. It might be that you have different types of patient participant involvement. And so when you think about it broadly, there are a lot of considerations. So have a think about that, and where you can introduce it. There we go. I'll stop here because we can ask some questions, answer any questions you might have, and I'll stop sharing here for that so that I can see you. Because at the moment I've been talking to the darkness. So if you'd like to, anyone, I can't see all, if everyone's got a hand up, or I don't know if anyone's got a better view than me because I'm working across screens at the minute.
That's fine. Yeah, I'll keep an eye on it. But yeah, we're open to questions or comments. Feel free, if you're shy or in a place where you can't ask a question, then feel free to use the chat box. Otherwise, just pop your video on and ask away. If you pop your hand up, we'll be great to hear any questions. I mean, I'll start with one, Katie, because the question I often get asked is, many of us are doing, well, are doing educational research, so students and teachers are involved. So if you were doing a educational project, would students count? As if you had a group of students and you asked them, would they count as PPIE, or does it have to be something outside of the educational context, so kind of lay people, as it were?
Yeah, I think that's really interesting. And the point of it is the lived experiences of the population that you are working with. So to your point, Hugh, I think, and we would include students within that PPI element, because if you are doing work with students, and we are overhauling a lot at the minute at the university, is having restructure, so there's an awful lot of what's being called personalized support for students that's happening. So that support is being designed for the purpose of helping students through progression, whether it's personal support or academic advising and all of those sorts of things, and access to different services that the university provides. So the PPI element of that would be the student body. I would see that. I think that's where the phraseology of public patient involvement and engagement, unfortunately, can work against the kind of the communication of the purpose of what this is. It's essentially about getting the views of those, the community of those that you'll be studying and working with, I would say.
Thanks, Katie. What we may do is move on just for a few minutes to talk about some of the other elements, but there will be an opportunity at the end as well, for other questions. So do pop those questions in the chat box if you need to. But just I'm going to share my screen.
And you're going to share now, yeah?
Yes, I'll share my screen. So I've literally got three or four slides to finish off with. And I'm afraid if you're hoping that I would say to you, this is where you can get funding from, and this is how you do your ethics, it's not going to be quite as straightforward as that, I'm afraid. But I will hopefully point you to some correct, some sources and places. And Katie, you'll shout if you can't see the screen, but I'm sure hopefully you can.
Yeah,
so it's certainly, as well as PPIE, which, as I said, Katie's already elaborated, I would definitely encourage you to think about. if not, linking that to funding, many funders, and certainly NIHR and big funders, would expect an element of PPI in every project that you do. So obviously that's not the reason for doing it, because Katie's given us other really good reasons for doing it. But that just to stress that point. For those of you who have been involved, would you just, as I'm in the next minute or two, just pop in the chat box sources of funding that you have managed or either successfully or unsuccessfully asked money for, because that'd be quite interesting to share with the whole group. If you're happy to do that, just pop that in the chat box. But the first question really is to think about, do you need any funding? Now, obviously, for large projects, and doctorates, etc., of course you are. But I'm thinking now of just starting out in clinical education. You're thinking of doing a little project yourself. You've got an interest in an area. You've got some time, or maybe don't have any time to do it in. It's first, sometimes you can actually do projects without any funding at all. So it's not an absolute necessity. So that's one thought. For example, I've been involved in a lot more qualitative work, and education research often are. And so you do some focus groups or some interviews. In the past, they would need transcribing. You'd pay them off for £10 an hour to a transcribing company, and actually don't need to do that anymore. So you can use Teams, or there are other IT companies out there as well, and do it for free. Now, it's not perfect, but it never was anyway. And part of the qualitative analysis would be familiarization with the data, so listening through it, correcting it, etc. And there are some other online companies that do transcribing, and you can get the first month free, that sort of thing. So you probably don't need money for transcribing. In fact, one funder, we requested money and they just said no, go and get it free online. So that's certainly made that cheaper. But thinking about other, if you're thinking of like a small qualitative project, you might be thinking about refreshments for participants, as an incentive to come along, whether that's lunch or coffee or tea. It always helps, often helps with student recruitment. You might be thinking of actually paying a student, to do some work, or a research associate assistant if it is a slightly bigger project. You might be thinking about vouchers, some sort of incentive if you're doing a survey. And that can be, a few £100. You can probably pay for all of those things. So you're not necessarily thinking of large amounts of money. So first question is, do you need any or not? And then where to go. Now, this is very much dependent on your area. And so that this is probably quite medical, because that's my background. And I'm sure those of you in other health professions could translate it into your own context. I'd certainly suggest just asking. And my policy with my institution is, well, if they only say yes half the time, then the more times I ask, the more successes I'm going to have. And they often say no, but sometimes say yes. And so why not? Association for Study Medical Education, I would encourage, if that's your context, to look at, because they do have various awards. I always like to say, well, things like the Small Grant Award, which is actually available right now, is easier than other awards to get, but maybe that's just because I've been more successful than some of the other bigger awards. But they have various awards. If you're thinking about larger projects and thinking, actually, I would like to go off and do a some sort of fellowship, then NIHR are the right place to look. These stand for various things, and practice fellowships, which are now called pre-doctoral fellowships, academic clinical fellowships, clinical lecturers. That's where the big money is for people doing this professionally. So if you're just starting out, it might be something to think about in the future. Then have a look at your own professional colleges. So for me as a GP, RCGP has a scientific board fund, and I would guess that most professional colleges, organisations do. The Wellcome Trust do, MPS do. I'm going to put Katie on the spot and ask her just to pop in now, just to say other sources of funding that you've been successful or unsuccessful at getting over the years, Katie.
Yeah, I think there's quite a few. So if you think about charities as well,
Good one.
going to various charities, and seeing what they may have. Sometimes they will put out areas of work where they feel that there's a need for people to do more work in relation to that. It's not always lab-based and bench-based, actually. A lot of it is around experience and patient-centered work, which I think is really, really important. There's also, if you, I don't know who's on the call and to what levels you're on the call, but thinking about the universities, and students have there are various pots that students can put into. There might be internships, for instance, summer internships that you can link up with somebody in an area. If you have a particular interest, say in innovation and technology, and linking that with medicine, it might be that you have an impact and innovation unit within the university. There may be a computer sciences group, and you come in with the medic side of things, and you're saying, I'm interested in doing a project like this. Is there any opportunity? Do you have any summer internships? Is there anything? It may be a step along the way, actually, where you're at that betwixt and between stage where you really want to do something, but you haven't quite got to that stage of confidence yet where you want to take the leap to actually have a small grant, because that's a responsibility in itself. It might be that you're interested in an area, so seeking out folks and saying, you know, I'm willing to help on the periphery of something. Can I be involved with something, and putting yourself forward? That can help in a step along the way, because then when it comes to you putting something in, you are able to evidence that you have a track record of participation. And then if you're helping teams, it might be that you are then listed on some of their outputs, their journal articles, things like that. So I think that that's really helpful. Also for women in medical education, there's quite a few different options. And if you are from particular underrepresented groups in that as well, again, there may be charitable, philanthropic, God, I can't get my words out today. I'm sorry, everybody. Philanthropic associations that do provide support to that. And research professional is a kind of RSS link that you can sign up to, and they will send out on a monthly basis, I think it is, various opportunities that there are across Europe in some cases for some of the big things, but it might give you an idea who's working in that area. I mean, what I think about sometimes, if I'm reading articles in the evidence base in an area that I'm interested in, who is it? Where are they? You know, do a little bit of LinkedIn introductions. Who's doing that work? Where do they, you know, where are they working out of, and making some of those introductions within that. Yeah,
Great.
if that helps.
Yeah, really helpful. Thanks very much indeed, Katie. So yes, why vast and wide, and ask questions, find out from other people, if other people that you know have got funding, where do they get it from? You know, papers you've read, where's the funding source? Definitely keep asking questions. And then just to mention about ethics. So do I have to? Why do I have to? I mean, the answer obviously is yes. And here are some the official reasons for why seeking ethical review. Obviously, bottom line is we wouldn't do anything unethical in our clinical work. So why would we do that in our research work? So I'll let you read those, but they're pretty straightforward and what you would expect. I think for me, just again, the practicalities note, because many of us have done evaluations in QI projects. And at what point is it a QI and what point is it evaluation? At what point is it research? And I think one of the indicators is for me is if you're seeking to get it published, then yes, it's research and it needs ethical review. The other ways to differentiate between the two, I guess, I mean, there is a quite a good HRA link here on the slide that's very simple questions just to answer the question, research or evaluation. For me, maybe I'm just too simplistic, but for me, it's if the answer, who wants to know the answer? If the answer is your own institution to be able to improve your course, degree, program, then it's evaluation. If you're thinking this is of interest to those outside of our institution, so I will be hoping to present it at a national conference, I'll be hoping to publish it, then it's research. Very simplistic, but for me, when I'm doing stuff with our students, that's how I help them to find the difference between the two. Who's interested, and where am I going to disseminate the findings? How to then? I mean, have a look at your own local institution. Each institution has a different method. Usually now it's an online form. Usually relatively straightforward, certainly compared to NHS ethics within the institutions. So if you've written a research proposal, which we'd expect you will have done, then it's a matter of copying and pasting from the research proposal. My own experience is that ethical reviewers are, how can I put it politely, are very thorough. Let's put it thorough, slightly pedantic. So if you haven't put version 2 on one form and version 3 on another form, they will pick that up. But maybe people like myself need someone thorough to look through all the documentation. But you'll need to usually include things like your consent form, participation information sheet, the interview schedule, etc. So it's predominantly all documentation that you'll need to do anyway. So see it as a way of someone else looking at your project and giving you some advice and helpful suggestions is what I try and say when I'm writing version 3 rather than version 2 and correcting my form. Again, another link here to does it need NHS ethics approval? Basically, if it's involving patients, absolutely does. The grey areas, say for those of us in education, is okay, I'm going to do a focus group with some hospital teachers on the website of Hospital X. Does that then need NHS ethics approval because it's on NHS NHS site? And that gets a bit trickier, and that's where you certainly need to get some advice and ask some questions. I have heard, well, I do know that the whole NHS ethics process, which is quite long and lengthy and asks for a lot more than the forms I've just mentioned. They are streamlining a version for people doing things like education, which will mean it's shorter and quicker. So I would say don't rule out completely, but just be aware it's a much longer and larger undertaking to involve patients, and so have a serious thought about whether you do have the time and the energy to do that. But on the other hand, we desperately need research involving patients in education, so don't let that put you off. So thinking again back to Katie's suggestion, the sorts of questions that you might want to ask from a PPIE perspective on the project you're doing. Similar questions: is it research? What ethics? Do you know how to source some ethics approval from your own institution? And what sort of ethical considerations I'm not touching on this, but what are the ethical considerations? Are there some? It's not just about anonymity and confidentiality. It's about power hierarchies. It's about safety that you need to be thinking about. But there are some great books and papers out there that will go through that in a lot more detail. And just final slide, just to mention other things to think about. There might be other permissions that you'll need. If you're doing some work in a hospital trust base, for example, then you will need permission from that trust, and each trust will probably have a different board that you need to get from permission. If you're doing stuff with students, there'll probably be some sort of research advisory group that you'll need to get permission from. strongly recommend thinking about collaborating. And then if you're asking questions, oh, how do we do this in this program? I've no doubt at all that someone else around the country is asking the same question. So I would definitely encourage you to look for others and seek out others who are doing something similar. And last kind of little tip is just think about dissemination early. You know, where are you aiming for? Who are the audience? Who wants to know the results of what you've done? And think early about then track back as to, okay, how's that going to influence your research and some of the practicalities that we've covered today. So thank you very much for listening. Apologies, we've used up all but a couple of minutes of the time. Whilst I'm talking, just asking if there's got any other questions. Yes, thanks. Marta's put up in the chat box the email address if you have any feedback and or would like a certificate of attendance. And I think Marta might even put up a slide just mentioning about the next webinar. But while she's doing that, any other final questions or thoughts that people would like to add? Thank you, Marta.
What I'll probably do is send you emails. You know my routine. Now I'm doing an email saying thank you for the meeting. And maybe aim to catch up probably in about 4 weeks, which is sort of week 5 of this block.
If anyone's got questions or comments about a specific project, that obviously we're not going to be able to give you detailed feedback, or detailed comments. But if anyone has, but is just a bit shy, then feel free. I'm certainly around for the next 5-10 minutes if people have got questions. But otherwise, I'll just say thank you very much for coming and joining us. And do look out for the next talk next month on how to publish, which is our speaker is one of the editors of one of the biggest clinical education journals. So great to have Paul Crampton with us from Clinical Teacher. Otherwise, enjoy the rest of your days. Thank you very much for the rest of your day, and thank you very much for your company.